Hi, everyone. This is Andrew Halmville from the University of New Hampshire. We'll get started in a minute. It looks like participants are starting to stream in. We'll give it a minute or two. In the meantime, you can look at my dog. Hi, Hazel. Okay, I'm going to go ahead and get started. I'll start the slides.
Hello, and welcome everybody to the National Trends in Disability Employment,
or nTIDE,
Lunch and Learn series.
Just a few housekeeping items before we begin.
This webinar is being recorded.
We will post an archive of each webinar each month on our website at www.researchondisability.org/nTIDE.
This site will also provide copies of the presentations, the speakers' bios, full transcripts, and other valuable resources.
As an attendee of this webinar, you are a viewer.
To ask questions of the speakers, click on the Q&A box on your webinar screen and type your questions into the box.
Speakers will review these questions and provide answers during the last section of the webinar.
Some questions may be answered directly.
Uh-oh, what did I do?
In the Q&A box.
If you have any questions following this recording, please contact us at disability.statistics@unh.edu
or toll free at 866-538-9521 for more information.
Thanks for joining us.
Enjoy today's webinar.
Okay, everybody, just a couple Zoom tips. Be sure to select the right speakers. Your speaker system, under the audio settings, you can click, and if you're not hearing through the right microphones or the right speakers, you can do it that way. Also, there's closed captioning is available. There's a closed captioning button that you can click on, and you can choose to show subtitles. You can also view the full transcript going as well. All right. So today we'll do a brief update of the numbers from, not from October, from, what is this? We'll add the January numbers. You'll hear from me. John O'Neill can't be with us today, but you'll also hear from Denise Rozelle from the Association of University Centers of Excellence on Disability. John O'Neill's not from Kessler Foundation, is not able to be here today. All right, just a little bit about nTIDE. It's a joint effort of the University of New Hampshire, Kessler Foundation, and the Association of University Centers of Excellence, University Centers on Disability, AUCD. This episode is a special noontime lunchtime. Given the unique circumstances of COVID, we decided to look a little bit closer at the unemployment trends. Because it's quite different than what we typically see. There's a lot of people on furlough, and that's a big difference between COVID and non-COVID time periods. All right. I'm going to give you updated numbers after this brief welcome, and then we'll open it up to Q&A. I'll actually toss it to Denise for some comments, some updates as well before opening it up to Q&A. All right, so what you're going to see is you'll see the employment to population ratio. We're going to look at basically the percentage employed of people with and without disabilities ages 16 to 64. What you're going to see is slow recovery from the Great Recession. Some good news where we actually see some improvement of employment of people with disabilities relative to people without disabilities. But then you'll see COVID hit. All right, so this is the percentage of people who are employed, ages 16 to 64. So what you're seeing is a decline with the Great Recession for both people with and without disabilities. The decline lasted longer for people with disabilities, and there was a slow recovery and for people with disabilities, there's, it bottoms out in 2013 and 2014, and then slowly rises. There is a bit of good news that's kind of hidden. And if you look at this area, 2016 and 17, that's when the economy started to go into full employment, where there's lots more help wanted signs. The overall unemployment rate for the economy goes, below 5 percentage points. And you can actually see there's a narrowing of the gap between people with and without disabilities. And that was really the first time in all the data I've ever looked at that I've ever seen this happen. And it's really when usually when we hit full employment, the gap kind of slows down or stays the same. It's never really improved. And then we see it kind of start to flatten out a bit in 2018 and 19. All right, but this is March. So this is March of 2019, 2020. This is just before COVID hit. And you'll see the big drop with COVID. People without disabilities dropped even below their Great Recession bottom. People with disabilities didn't really drop substantially, and percentage-wise, it's a bigger drop, but it didn't go below the bottom of the post-Great Recession period. In May, we see some improvement. So we're starting to see some restrictions on economic activity be lifted. Same in June, a real big increase for people without disabilities. And so the economy is starting to reopen. Testing is starting to spread a little bit. This is before the spikes that we're seeing in parts of the country in the summer. And we're starting to learn how to use masks and the face shields and the plexiglass, people working, figuring out how to work online. Things start to slow down in July for people with disabilities, some pickup in August for both people with and without disabilities, but then we start seeing September. Let's just trip through these to the most recent data, and this is the most recent data that we have. Basically, we see some improvement, but then kind of a slowing of improvement over the last few months for people with disabilities. Actually, a decline a bit for people without disabilities, kind of a slow march down after, slow march down over the last 1, 2, 3, 4 months. And so, we're getting closer to the point where we were back last January, but still quite a ways away, both for people with and without disabilities. One thing we want to do is the pandemic recession is much different than previous recessions. We have a lot more people who are going on temporary furlough, and it's quite protracted. Our high rates of unemployment are pretty protracted, in part due to almost probably wholly due to the pandemic itself. All right, so here we see the dramatic jump so we have people with disabilities on the left, the right, and people without disabilities on the left. We see a massive jump, like 5 times. We see a doubling of the unemployment for people with disabilities. And we see that mass jump in both people with and without disabilities. We see a huge jump, and then we see a slow decline in the number unemployed, except for in December for people without disabilities. Some restrictions. We started seeing the response to this would be right around the time when we're starting to see an increase in hospitalizations post Thanksgiving. And for people with disabilities, we see this decline, but it really hasn't been moving very much over the last several months. So let's put in January. So for people without disabilities, you see, again, a small rise. For people without disabilities, we also see a rise compared to December. So it's really been, when we were talking this morning with folks at Kessler, so Elaine Katz, Carol Ann Murphy, Nikki, and we all sit down and start talking about these trends. If we look across all from like midsummer, we're not really seeing a whole lot of action for people with disabilities in terms of the unemployment, the sheer number of unemployed. For people without disabilities, there was this continuous decline and then this recent uptick over the last 2 months. So, when we started seeing this, it's like, wow, there really hasn't been much progress since June, right? And the next couple slides will kind of tease this out a little bit. So we're going to split it between people who are on temporary layoff versus people who are actively looking for work. So temporary layoff is akin to furlough, right? So people who still have attachment and are expecting to go back to their, are hoping and expecting to go back to their employer. So we split this up for people with and without disabilities. And you can see that the percentage on temporary layoff was tiny. The average in 2000, the monthly average for 2019 was 13%. It jumps up to almost 80%. And this is unprecedented. The highest rate I ever saw when I went back and looked back to the 60s when this data was available was in 1973. It went up to 25% when there was a bunch of that's when the automobile factories were closing due to this 1973 recession and the first oil crisis. And you can see this slow decline in both the number, but also you see that the unemployed starts being represented more by the light blue, the looking for work. So that the people who were on furlough either went back or perhaps they lost their job and started looking for work. But it's really been pretty declining over time. But the proportion that is looking for work this proportion has declined as well over time for people without disabilities. For people with disabilities, it's a pretty similar story. But again, we see that it's overall that the height of these bars are, that's that constant. So we haven't seen much movement in the number of unemployed people with disabilities like we have for people without disabilities. And we see this, the percentage who are on temporary layoff has really not changed much since September. It's pretty stagnant. We have a large number of people with disabilities looking for work. And, the use of temporary furlough is kind of staying relatively flat. And so this suggests, probably how, in some sense, it reflects how I feel about my own situation where, boy, things just haven't changed. It just hasn't, things are really staying a lot the same. There's not a lot, it's not like we're opening up sports events. It's not like schools are, universities and schools are dramatically different from what they were in, say, the summertime or the spring and the fall. Really the idea for COVID that I think I'm seeing and that a lot of people are seeing is that the first few months were this huge hit as we readjusted, but then we have this chronic level of of unemployment that just seems to kind of reflect some of the restrictions that we see, but not a whole lot is changing. And so I'm going to stop there. I'm going to stop there, and I'm going to tell you a little bit of good news. So there is a little bit of good news in some of this relative to people with and without disabilities. There is a difference. So we're looking at both the percentage who are working plus the percentage who are looking for work or on furlough. So this is a measure of, are you in the labor force? So to be in the labor force, you have to be either working, looking to work, or on temporary layoff, on furlough. If you're not actively looking for work and you're not expecting to go back to your previous employer and you're not working, you're considered to be out of the labor force. And out of the labor force is something that really kind of signals that that you're disengaged from the labor market, and the longer you are, the harder it may be to go back to work. So you see the similar pattern that we had for people for the employment to population ratio. You see the Great Recession, a decline and kind of a very meager recovery. You see a decline for people with a faster decline for people with disabilities, a slow recovery. You see a little bit of catching up for people with disabilities in 2017, 16, and 17. This starts getting a little closer together. It flattens out in 2009 and 2018 and 2019. Here we put in all the months that we have available. So this brings us up to date. You see the big drop for people with without disabilities. You see this huge drop in labor force participation, and then a slow decline after the initial recovery for a couple months. For people with disabilities, we're really seeing a flat level, such that these differences are not statistically significantly different. We have a paper that we're working on that will publish this stuff and put in the error bars and look at statistically significant, whether these are statistically significant changes. This change, this change that we're seeing over this period of time is really not, we're not detecting any major changes with the data that we have. And this is suggesting that people are with disabilities are staying engaged in the labor market, either working, looking for work, or on temporary furlough. That for me, this is positive because people aren't exiting, but it also could be a sign of severe stress. About 1/3 of the population with disabilities, the working age population with disabilities, lives in poverty. And so it may reflect the real need to stay engaged. You have no other alternative in order to keep your family's income up to where it needs to be to survive. And so this is a good story in that people are staying engaged, but it also could be a sign of stress that there's really no other alternative. So I'm going to now turn it over to Denise, and we're going to do Q&A after that. So okay. Denise, take it away.
Oops. There we go. Okay, so a couple of things I want to just hit on today. We talked a little bit about some of this 2 weeks ago. If you happen to be on the first of the month nTIDE in February, but I just want to give you a couple of updates on some policy things going on in Washington. Important things and important for you all to know about. One, and I mentioned that this had not happened as of 2 weeks ago, but it has now. The Biden administration has reversed the Trump administration's position on work requirements in Medicaid waivers. The Trump administration had been allowing, although a variety of lawsuits had found against this, but they had been allowing Medicaid agencies to require work requirements in order to access Medicaid. Like I said, there were a variety of lawsuits against that. All of them had played out to say this is not part of the Medicaid program. You cannot allow work requirements, but states were continuing to push forward to do that. And there's actually a Supreme Court case which is about to be heard on this topic. In the meantime, the Biden administration has reversed and said, no, we're not going to support work requirements in Medicaid waivers. So they have sent letters of, quote, preliminary disapproval to all of the states who have been asking for Medicaid waivers, work requirements within their Medicaid waiver. Those states are Arizona, Arkansas, Georgia, Indiana, Michigan, Nebraska, New Hampshire, Ohio, South Carolina, Utah. Tennessee is not listed here, but I think Tennessee has too. So anyway, they have gotten letters saying preliminary disapproval of requiring work requirements in your waiver. So that will mean that any lawsuits any lawsuits going on in those states to stop Medicaid waiver requiring work requirements will be unnecessary, I guess. But that's an important thing. That is a very important thing because clearly Medicaid is, well, I don't need to explain to this group why that's important. You don't want to be requiring work in order to be on Medicaid, period, bottom line. That's not what the Medicaid system is set up to do, nor was it the way that it was intended to act. It's not one of the requirements under the program. So adding that in was outside of the requirements. So that's one thing, good news. Second good news, home and community-based services. I talked to this group a lot about home and community-based service money. There is, and we have been trying to get some targeted HCBS funding in one of the COVID relief packages. There was one early on that had some, but some through do Medicaid increases, but not targeted HCBS money. So as of right now, the Budget Reconciliation Act that Congress is trying to pass, that's the one you keep hearing about all the time, that is $1.9 trillion that the Biden administration is promoting. That $1.9 trillion package includes a 7.35% bump for 1 year in Medicaid, in the FMAP rate for Medicaid. That means there would be an additional $9.3 billion going to states from the federal government in Medicaid HCBS money. It is, as of right now, included in both what the House and the Senate are talking about. Having said that, and there's a great letter out, I'll put the link in the chat. There's a great letter from Senators Hassan, Casey, and Duckworth that was signed on by a whole bunch of other senators, saying why this is important, saying we need more money for home and community-based services, saying, you know, these are services that keep people in their communities. And right now we need to keep people in their communities. The whole argument about congregate living and COVID spreading congregate living, and just the generic, we need to keep people in their communities. So there's a great letter, there's some great work on this. However, having said that, there is never a guarantee for this. So if I'm going to put in a plug for you and to tie it to employment, absolutely, Medicaid home and community-based services support employment by people with disabilities in the community. There are very specific things that you can do with that money, and I'm not going to go into them here, but it absolutely supports employment in the community. So if you are to do nothing else today or tomorrow, please call your members of Congress, call your legislators, call your senators, and let them know how important home and community-based services are to you, to your family, to your students, to the people you work with, and why HCBS money is important. That would be my one request of you. There's more information, and you can go find, there was a day of action this week on Wednesday where my organization, AUCD, the ARC, a variety of other organizations did a targeted social media call to the Hill day. So if you go and look on the website for any of you can certainly go to AUCD and find it, but look for any of your community-based organizations or the national organizations of your community-based organization. You're likely to find talking points, but the most important one is just simply, we need to keep people in the community. It's both what people want, it's where they're getting services now. We don't want people to have to move back into congregate settings. And particularly in a time of COVID, we need to be keeping people in their communities. So I really, it's been included in some of the past COVID legislation that we've seen, and we haven't made it across the finish line what was actually included in the end. So we need your help. And this is a big deal. This could be a very big deal. The only other thing I will say, one of the other things that's in these bills, and it applies it's kind of the employment, but you need to know, in the past COVID relief packages, the bills that have the funding that has been paid, the checks that have gone out from the federal government directly to individuals, have not covered adult dependents. There have been no checks going to those adult dependents. These bills right now, the reconciliation includes coverage of adult dependents. And I know that's been an issue for a lot of people. So Andrew, I'm going to toss it back to you. Those are the most important things right now. And lastly, there's one other. I said on the call we were on a couple weeks ago that it looked like the minimum wage hike was included in the bills. It now looks like that's not going to pass the Byrd rule. There's a rule that says you have to, in the Senate, that says you have to have, in order to get it considered in budget reconciliation, it has to be related directly to funding, et cetera, et cetera. There's a long, if you want to learn more about the Byrd rule, go look it up, BYRD rule. But it looks like the parliamentarian will probably not allow the minimum wage hike to go through in this particular bill. It doesn't mean we aren't going to keep trying for it. It doesn't mean, on and on and on, but it doesn't look like the $15 minimum wage increase will go through in this bill. And in fact, President Biden has been signaling in the last few days that he hasn't come out and said, I'm not going to be willing to fight for this, but he has been indicating to governors that he doesn't really think that's going to end up in the bill. So for those who have been watching for the minimum wage increase and the hope that it would do away with some minimum wage, et cetera, not going to happen in this bill. We'll keep working on it. There are more bills out there. Raise the wage is still out there. The transformation to competitive employment is still out there, but it's not likely to happen via budget reconciliation. Okay, that was the end, Andrew. Now I'm done. I'm tossing it back to you.
Getting unmuted. All right, so we have one question, and I'd be interested in your take on this too, Denise. So Lynn asks, I want to pitch the media about the impact of COVID-19 on people with disabilities with regard to employment. What would be the most dramatic and succinct way to use maybe a piece or two of your data? So this is something we ask ourselves when every time we get together to do things either on this phone call or on our Friday morning phone calls with Kessler Foundation, the folks at Kessler. You know, I think that one of the probably the most dramatic thing that always kind of gets lost in the COVID is that here's how I would pitch it. I would say that number one, you have to recognize the gap between people with and without disabilities. You know, the huge difference in the percentage who are employed, right? So that's the first thing right out of the gate. The second thing is I would recognize that there were improvements, like, you know, historic improvements prior to the pandemic. You know, the improvements slowed down over the last year or so, but there had been improvements in the gap between people with and without disabilities when we hit full employment, right? When the economy was really chugging along. And that the COVID pandemic really slowed that story, right? Really kind of, I mean, it was already slowing down in 2019, but that COVID-19 really destroyed it. And, you know, the thing that's worrying me now, I take, somebody's texting me. It's not Kate or anybody telling me to speak up. How I would frame it is, you know, I would be worried about the future. So what happens as the economy kind of recovers, right? What does that mean? You know, we're seeing kind of stagnant percentages employed. You know, if I go back up to, don't look, I'll make you dizzy. But if you go back to this diagram, you're really seeing this flat, I mean, there's no change, right? And, you know, that worries me. You know, it worries me. You know, we were seeing a large decline for people without disabilities and some slow retrenchment now, but we really never saw any massive improvement for people with disabilities. You know, some of this may be, I mean, these are based on sample surveys. And so some of this is, you know, the moving around of because of the sample, because it's based on a sample. But, you know, I think this is a big concern, you know, because there's not too many people left that are connected to their prior employer, right? The number of people who are on furlough is not connected. And so I worry about the future, about how it's going to open up, right? If you think about the jobs, you know, this furlough kind of like, if we reopen right away, these people have a connection to an employer, right? Their employer still exists. The employer hasn't gone out of business, right? But what about the others who are actively looking for work, right? There's a large group of people looking for work, and it's good that they're staying engaged, but you know, I worry about that in the future. You know, I think that's going to be, you know, knock on wood, we get the vaccines out and we start recovering. You know, what does it look like when we start recovering? So restaurants open up, travel opens up, sporting facilities open up. Some processing plants open up. Some small manufacturers have had difficulty getting, although they've probably resolved some of that if they're still in business. What are the businesses that went out of business, and how are those jobs being replaced? So if I was doing it, that's the problem with succinct numbers. You asked for succinct, so that's plaguing me. Succinct. Things haven't changed much since July, right? We saw huge improvements, in May and, well, it's at least in June and July, but since July, we saw a nice positive trend, but maybe this is just flattening out since October. It's just really depressing to look at. Does that answer your question, Lynn? I hope so. Denise, what do you think?
I was going to say, geez, now I'm depressed.
Sorry.
No. I think that's right, because some of what I look at is the fact that we have, on the one hand, that's the big employment market, and you're right. What I've been looking at is the more detailed what's happening to congregate work environments, or the sheltered work, and the hope that coming out of all of this, we're moving more toward competitive integrated employment, both because that's where the paradigm's moving, that's where the legislation is moving us. When you look at WIOA, that's where now this whole congregate conversation, I think, is moving us. I think there are moving toward customized and competitive integrated employment, which is great. But then when I layer that on top of what Andrew just said, what it means is we have more folks with disabilities ready for competitive integrated employment, I hope, but where's the place for them?
Correct.
So, right. So my hopeful attitude about what's happening next, and we've got legislation coming, again, on the policy wonk, we've got, raise the wage, we've got transformation to competitive integrated employment, which is the Casey bill, which actually has some funding with it to help states do a better job to move toward that, competitive, customized, et cetera. But there still has to be a place for people to be employed. And that's the part, quite honestly, Andrew, until you just said that, I hadn't quite gone all the way down that road. So very interesting. But I think that's an interesting conversation to have. How do those two things line up together, and how do we address them?
Yeah. Some of the things I'm working on. So Lynn has another question.
Exactly, Lynn.
Will people with disabilities be competing for those few jobs when things open up with people without disabilities? Absolutely.
Yeah.
If I look at the big industries that are left, they're not necessarily ones that are great and favorable to people with disabilities. Entertainment, travel. There are a lot of people who work with disabilities who work in the back of the house at hotels and restaurants, but not the front of the house. So that's not always the greatest in terms of competitive integrated employment. I don't know how to, I'm trying to come up with the positive, but I thought of another negative that, we have all this work from home now, and everybody's like, okay, that's great, right? Is work from home competitive integrated employment good? Right. So if somebody is facing barriers, we think of employment as being this great barrier of integrated, right? Of being socially active and being socially integrated. But if you're working from home, you don't get that positive social benefit. And I think many of us who work from home are, gosh, this sucks. Oh, sorry. This really isn't all that great. I miss my friends and colleagues at work, and some of the social aspects that employment is such a key part of building friendships that I think it's I don't want to be negative. Maybe anonymous attendee has a question. Maybe they're more positive. Is there some concern that many employers simply won't return to their pre-pandemic staffing levels? Ugh. If there were able to make do with less now, you're not saying any good news. We won't many try to find ways, see how few additional employees they need to hire when things return to quote unquote normal. I think of restaurants as an example, giving tighter margins, right? So restaurants are usually pretty slimly staffed. Certainly, it's hard to kind of trim your back of the house staff, your cooking and cleaning and janitorial type staff. Your upfront staff is really driven by the number of employees. The industry that I was thinking of when I first started reading your question is facilities, right? So if I think about big office complexes. Pre-pandemic, there was already a move to people working from home or having smaller facilities where people would what's it called? Um, Desks, hot desking. There was something like that where you would share a desk with somebody. You'd come in and you would share a desk. Even ACL in DC at NTIDE, they were moving towards that model where you would share a conference room. Groups would share conference rooms and share pods to come in when you were working from the office. And the reduction in the number of offices, was already starting in many cities. So it might be something post-pandemic. Automation. So Elaine has a comment, Elaine from Kessler Foundation. Automation is already taking over jobs where, good news there. Automation is already taking over jobs where companies want to save money during the pandemic. Chewy toy company, supply company, Chewy toy. I have a Chewy toy. Chewy toy company just built a completely automated plant in Pennsylvania where only few high-level engineers as employees. Thanks, Elaine. Yeah, so automation. So again, that when they open up, I don't think there'll be a lot of excess capital, right? Automation depends on capitalization, right? And how much capital firms have to spend to redo that. That Chewy toy, they must have said, well, if things are bad and I've got these great loans from the feds, let's build an automated capacity to do squeaky toys. Uh-oh.
I think part of, Andrew, I think what I would add there is, I think what we have to recognize is we are part of the big system. So as all employers are having to rethink what's coming back and how it's coming back and who's coming back and how many people you need and what new sectors are going to open up as people come back, et cetera, et cetera. We're part of the big table. We also, people with disabilities have to be involved in that conversation and we have to be thinking that way too. I talk a lot in the policy world about, if you want to be at the table, if you are part of that big conversation, then you're at the table and you have the pluses and minuses that everybody else does. So we really need to think about, what does that mean for customized employment? What does it mean for competitive integrated employment? What does it mean for, what are the new areas opening up? How can people be more involved in those? How do we access those? And it's a good news time of change, I suppose, but boy, getting there could be really painful.
Yeah. A couple of comments and questions that have popped up around the need to create internship programs for students with disabilities ages 16 to 24 to offer career exploration, a la the Project Search. I think that internships are a great place, are a good thing to have during a recession. If I think about people who are unemployed, internships is it kind of reminds me of the Great Depression, the CCC and all the the jobs programs, where those could be seen almost as internships in a way. They're federally created jobs. I drive the Merritt Parkway in Connecticut, and all those things, all the bridges are customized by artists, and it was a way of giving artists jobs. And so you know, I really see that as akin to internships. It's like, you know, if you're going to spend the money, you know, try to do internships. And the big issue, you know, in being at a university, all the students are fighting for internships. And now the internship market is almost national, because a lot of it is done at a distance online. But internships and making the match is the making the right match is the art form to those kinds of programs. Similar with job sharing and job carving, very similarly. So Joseph brings up that point. Job sharing, job carving may be more mainstream. I think that could be very true, both for people with and without disabilities. If you take into the anonymous comment about when things go back to normal, they'll be trying to tighten those margins. Job sharing may be the way of doing that, and in a way that's not always helpful, because it may be, you know, everybody's part-time. So you share a job such that you don't have to give full-time benefit. So there could be, oh boy, could be some real challenges.
I think, Andrew, I also would add that we should keep an eye out, because we're beginning to already see them. Like I said, kind of adding, let me put it this way. I think we are going to see expansion of some existing opportunities to people with disabilities. What I mean by that is, for instance, we're already seeing some legislation around apprenticeships that are traditionally, I mean, like industry recognized apprenticeships, traditional apprenticeships that traditionally are tough for people with disabilities to get for a variety of reasons. Yeah. But I think we're going to see some language that is disability forward in some of those pieces of legislation, which may be able to provide some opportunities. Because it's not just, if you think about it, folks who access what we would call industry recognized credentials or industry recognized apprenticeships, folks with disabilities who are having troubles with accessing those. There are also folks with limited English proficiency. There are also folks from other countries who are here, immigrants who are having troubles accessing those for a variety of reasons as well. So I think we're going to see some of that movement. And there's another piece of legislation I was looking here on my desk to see if I could pull it, that also is that kind of bringing people back into the workforce. And we're going to see some, I think we are going to see legislation about bringing people back into the workforce. It may or may not be disability specific, but if it isn't, I think we'll see disability language in it, which means it is open to, and hopefully then we can work to make it applicable to people with disabilities. I think we are beginning to see some of that, and this administration seems committed to that.
Yeah. Elaine brings up an interesting issue around, nonprofits serving people with disabilities. So some of the service delivery system, many of those people are on furlough. Will they be rehiring? What will happen to service delivery? And, I don't know if anybody's heard, some folks at UNH are doing research on the effectiveness of telemedicine. Has anybody seen anything on the effectiveness of tele-job coaching or workplace supports? Has that been, all signs point to a pretty favorable opinion of telehealth. It really helped fill in a gap especially when we had travel restrictions and office restrictions, and it filled a niche and seemed to have done an okay job with it, right? Is that true for other forms of service delivery in the employment sector as opposed to the health sector?
There is some work being done on that. Again, not pulling. I believe some of that's included in the new APSI study for one thing. But I think there is some work being done on that. I just was in a conversation on that, as a matter of fact, because part of what we're hearing is that, good news, bad news, some folks absolutely love that. Folks with
Yeah.
disabilities love the fact that you can do telework and get services that way telework training, for instance,
Yeah.
not the work itself, but the training and the supports, employment supports. For one thing, because as they're saying, it means that nobody's walking in and out of my house all the time. I actually have my own space and my own house, and there aren't service providers coming in and out all the time. And there are people who absolutely love that. I think we're gonna have to wait and see, because then that raises some issues about, as you were talking about, being part of the community, interacting with people and all the rest. We're gonna have to see how that plays out. But I think there is some work being done around that. The folks in the UCID in Arizona, I think, are doing some work around that. There are a couple of places that are doing some work to see. And I think some of the questions are involved in the APSI study as well.
Yeah. Elaine mentions the Kessler Foundation project with Julie Christensen,
exactly,
around just-in-time support. And now that we're, a lot of people are being trained on distance learning and distance working, even if we go back to the brick and mortar work, Zoom, our wonderful platform here, a lot of those things will be those skills will be maintained, and that infrastructure will help. And so I think that there's positive. I would say that in that that kind of remote workplace support, when I think about the future and I think about remote working and the potential of being isolated in remote work, or not having effective supports because it's only remote workplace support, I think it's going to come down to choice, right? Whether that's what people want to do, or that's what the services the way they want to receive their services. I think that if instead of having COVID lead to a specific type of employment, have to more employment opportunities and have more choices of how to interact with folks and interact in the workplace and work and receive services. That's kind of my soapbox. We're at 47.
Isn't that the point? And thank you, Elaine. It was the work that Julie did Julie, and then Wendy Parent-Johnson was working with her. And I know Wendy's continuing to do some work in Arizona, but yeah, the Iowa, Nebraska, and North Dakota was one of the ones I was thinking about. And it was very successful, remote workplace services and supports. So I think it really can be done, and can be done well.
Yeah. So Joseph mentioned that some parents have been pleased with the OTPT, probably speech and other services they've received probably remotely. And so I'm going to ask if there are any final questions or comments. This has been a really interesting conversation, sparked by Julie's or Lynn's question about how to present this to what's the most succinct way. And I think it's hard to, these kind of time trend statistics are hard because it's not just one number, it's a comparison of numbers over time. And I think we do have to start thinking about the future and while we're waiting. Michelle brought up the need to replenish stockpiles of PPE in the United States. That could be a niche industry because it's not just it's restocking and maintaining. And, we got into the position where PPE was being produced being produced overseas. And there was only one place in New England that was producing a certain type of glove. But that could be niche industries as long as it's competitive integrated industries. So I'm going to stop there. Any other final comments, Denise?
Yeah, that's great. Good conversation, folks. Thank you.
Yeah, so hopefully COVID will lead to more choices and more opportunities, not restricted, lesser, isolating type jobs and services. All right. Thank you, everybody. It's a great session. We're going to close. I'm going to move us to the end slide. Thank you all. Thank you, Denise. Thank you, Elaine at Kessler Foundation. And thank you all for your comments. Have a good afternoon and weekend. Bye-bye.